Alrighty, had a headache there. Alrighty, so we went ahead and we plus some Mitadrine. Hello.
Hello.
There we go. Alrighty, so you said it hurt. What hurts, Olive? Olive, are you with me?
I feel like I'm having a big anxiety attack, but it hurts.
Okay, well, that's kind of like what you got admitted for. So let's go ahead.
Anxiety attack.
Well, no, for broken heart syndrome.
Oh, what the hell is that?
Who knows? Well, let's get you taken care of here. First and foremost, let's get you a little bit more comfortable.
Okay. Can see the light.
Alrighty, we have EKGs going on, and we've got you some medicine to keep the blood pressure high because you were bottoming out.
Okay.
So let's see what else is going on here.
Okay. Just feel so sore all over.
Okay, well, let me look you over.
Okay. Might as well have a bed for me in here. Oh, with my
What?
name on it.
No,
Might as well
no.
have a name for me in here.
No, we only do that for Jerry Callow.
It's a joke, Mercy.
Yeah.
Sarcasm.
Yeah, so was mine.
Okay. Well, he is the governor, so.
All right, trying to see your heart rate, and if we got stabilization on the BP after that medicine.
Okay.
Okay, heart rate is fine. Let's see if BP is stabilizing for me. Still quite low, but it is raising from where it was. So we're going to wait and see that medicine and let it do its work. Let's see here. All right, you had bradycardia last night with your pulse dropping to 15 and then a flat line. Let's see. You had no abnormalities that were seen. So I'm going to go ahead. I've got an EKG hooked up to you, so we're going to wait for this printout and see if there is any anomalies that I need to be paying attention to. Let's wait and see what she says. We also have that physical that needs to be done in 5 minutes. Just waiting on that results from that report. Okay. Still just waiting on those results. Oh my goodness, again. What is going on here? What is going on with my internet all of a sudden? There we go. Alrighty. Can you say that again for me, Tegan? What were you reading on the EKG? Guys, I am so sorry. I do not know what's going on with connection this morning. It is what it is, though. We make it work. All right, let's see what the irregularity is due to. I don't know what she wants. I don't know what direction she wants to take the RP. She's not really giving much, and the report gives absolutely nothing. So she's going to have to give us a... She's going to have to pivot us. Because at first she was saying anxiety, now there's irregularities in the EKG. So she needs to give us a path, basically. And we keep getting text. Okay, we're gonna wait. All right, we're just trying to place the reason for the irregularity right now. This is the awkward part of doing med RP, is waiting on what the person was wanting to do. Excuse me, I'm so sorry, guys. Oh, jeez, I hate this. All right, Tegan, let's say that again. Tegan, what were you saying that irregularity was? You know me, my Greater Pacific Tech knowledge here. When people give like very, very in-depth medical things, it's like, guys, we're not real doctors. So I'm gonna have to look it up. Tegan, what was that irregularity again? Oh my god. Guys. Mercy's gonna go off duty after this. Alrighty, so then let's talk about, since we have a weakened left ulterior wall, we have some different things that can be as far as treatments, Tegan. So let's walk through those and figure out what we're going to be doing here. We can do it with medications. We can look at ACE inhibitors and beta blockers. And also look at a few antagonists. We can also go with an SGLT2 inhibitor. Or we might have to do a procedure, surgery. So we might have to do an ICD. However, doesn't look like she's had much cardiac arrest, so I would not think that it would be to that. It could be that she needs a CRT, which again doesn't seem like she's had long-standing issues with her heart. It could be an LVAD, which is just a mechanical pump, basically where we go in and replace the pump that's already there with a mechanical device to help it. But that's usually a bridge to transplant, which again, we haven't seen prior damage to the heart, or it could be heart transplant. So maybe something that's just gone undiagnosed. I'm going more the medicinal route, but you're going to have to tell me, Tegan, what your thought process is with the imaging. Because as you know, I'm a neurologist, not a cardiologist. I wouldn't blame Mercy for that. Mercy's probably going to go off shift after this one. We also have a person who's waiting for an assessment, and I always feel bad when I make people wait. Alrighty. Let's go ahead and Tegan, are we going to run those intravenously and then keep her in the hospital and see how they work? Or, Olive, are you wanting to go ahead and be discharged? You're in observation, so we can't keep you anyway. Are you going to see how these medications work for you at home?
Yes, I mean, I think that maybe, I don't know. I need to get some kind of shape to go back to work at DOC. I think
I can't approve you for back to,
physicals.
yeah, you're not going to be approved to go back to work in your current condition. Just to be fully transparent. I would not clear you.
Shit. Yeah. But then they let me go on a plane at this point.
No, honey, that's going to be your decision, but I can't clear you for work. Do you want
Okay.
me to give these intravenously to you and you stay here and recover, or do you want to be dismissed and I give these to you in pill form?
Let me be dismissed. I really don't want to sit in a hospital. I hate hospitals.
Okay.
If I feel bad, I promise I'll come back. Should I just be with somebody
that's up to you.
I'm not.
It's best practice, but that is up to you. I am going to go ahead and remove your IV port so you can feel some pressure.
Okay. Thank you, Mercy. Why was that?
There we go.
No.
Alrighty, let's go ahead. Let's walk over to the pharmacy.
Okay.
Magic, magic, magic. After I finish with this patient, I've got to go to Serial Healers for an assessment.
I need to call Henry.
No calling.
Hopefully he's around today. Do you know anything else about the broken heart? Whatever.
It's just what they call it. You're having irregularities in your heartbeat and your blood pressure's being erratic.
I thought only old people get that after the die.
Well, it's according if you don't take care of yourself, like chronic smoking, consistent injuries, all of that can lend to it.
Okay. So it's pretty much a mystery.
It's what?
It's all in all a mystery.
Not
I
really.
see.
If we don't take care of ourselves, it's going to break down our body and put extra stress on our heart, and it makes our heart to where it becomes quite fragile.
Okay, I'm sorry.
No reason to apologize to me.
Okay.
John, I'll have to call you back, okay?
Okay, no worries.
Hi, Henry, can you pick me up at the hospital?
Take one pill every 12 hours to relax.
I'll give you some money for it.
Blood
Thank you.
vessels
Okay, Polito.
and strain on heart.
Oh, really? Oh, okay. All right, bye, Henry. Thank
14
you.
pills prescribed.
Hello,
6,
welcome
21,
aboard.
2025.
Fuckload of gunshots at Grove Street.
You didn't crash the car again, did you, Mercy?
No,
yeah.
no. Olive, what is your state ID, please?
Not known currently, I'm staged
19974.
nearby just to be safe.
Okay, so we're gonna do
So far, Petey's only called
lisinopril.
out people running around.
And
not
she doesn't
any
need a
injuries,
metoprolol
but
because she doesn't need her heart rate slowed or her blood pressure lowered. Let's go ahead and do a
Is there any
spironolactone.
signs I should look for
Yes.
to go back to the hospital?
If you start getting faint, if you start getting lightheaded, blurred vision, if you start passing out, these can all be signs of your heart not functioning. If you can feel erratic heartbeats, you need to come to the hospital immediately.
Okay, okay. I will take it easy today.
Mercy doesn't believe her. What happened to you?
I feel like Swiss cheese and I'm rattling like a keychain.
Alrighty, let's see just exactly what's going on, darling. Let's see if it's grazes, if you took him to the vest, if you got a lot of bruising.
How many? 15 to 16. Holy shit. I'm gonna go down and help people move. What happened?
Excuse me, I am so sorry. All right, you are Swiss cheese. All right, we've got 9 lovely gunshot wounds going on here. I am going to flush the areas because first what I need to see is there any arterial, so arteries, or organ damage? Because that's what we need to work on first if there is.
I'm gonna have to utilize recovery room.
Tegan, if you will, let's go ahead and start doxycycline, a slow drip morphine. I also want to start an ONEG blood transfusion, please.
Yeah, you can also take it on the
All right,
way.
we've got
Yeah.
7 launched.
have
Again,
to
I want to see if there's any
utilize
arteries or organs damaged before we even start removing anything.
Can we use this perfectly?
Damn, Stevens, you're like a boss over there. Just, so cognizant. Luckily, you have no arterial organ
It
damage.
hurts so much right now.
It's okay. I'm gonna go ahead and I'm
I
gonna.
think the adrenaline is starting to wear off.
Yeah, I'm gonna numb your entire upper half, so it's gonna be numb for like 4 to 6 hours.
Alrighty, what's going on? Who's us off here?
Let's find a bed.
All right, lovely. There's 7 casings I have to remove first. We're gonna go in and just follow the natural trajectory that they went in, get those removed, and then I'm gonna start cleaning and suturing. Okay?
See, this is critical or
I've
non-critical?
got you numb. Okay, you're gonna be okay.
Critical, you know?
Yep, but I still feel something in there.
Everybody-
Just some
everybody
pressure.
right now are
Don't even think about something else. Tell me about before this. How was your day?
I woke up. That's what happened.
Oh my God, you're
And shots started
alive!
firing.
Alright, what's going on here?
I was spending a lovely morning
Mm-hmm.
with my girlfriend in bed, just cuddling,
Mhm.
and then I woke up, went to work, and shots
Who's
started
this-
firing.
Who's your girlfriend?
Penelope.
Oh. This must have been the other guy that Jimothy was talking about.
Alrighty.
And now look at you, still laying in bed, in close proximity to Penelope.
Yeah, but now I'm more bullet holes, and it hurts.
Okay. Just gonna go ahead. I'm removing all the necrotic and damaged tissue. That's gonna get scar tissue removed out of there for the next surgeon that has to maybe work on your torso area.
I don't like this feeling of you being inside my chest. It feels weird.
Well, I'm all up in there, just fingering those
Especially being
pecs.
conscious.
Echo 41, 1041.
I'm gonna wiggle my fingers in your holes.
Don't wiggle your fingers in my holes.
Mm-hmm. Steven says, but Penelope also dates a lot of people.
I can't answer this phone.
It's okay, lovely. I'm finishing up. Alrighty.
Yes.
Oh my god. Wait until I'm done treating you.
What? Can I call you back? I'm a
Reese,
little
I
busy
have
right now.
2 more seats. How many do you have available?
I'm full up right now.
Okay. Are you?
Alright. Rest
Listen,
here.
15, If you're
15245.
full up, do you have any?
Stop
critical?
talking on the phone.
All right,
I have one who's bleeding badly. I can't find the.
All right,
the
Jesus
sorry,
fucking
Elvina.
Christ. You're in the
and
fucking hospital bed. You would not answer a fucking phone when you're in surgery, you little bitch. Now listen, you are
My
numb.
God.
You're gonna let your O-neg blood transfusion finish. You're gonna rest here until you're 100%, and then you're gonna get out of this bed so somebody else can get in it. Have a good day.
Yeah, there's a lot more people coming, so
Hey, Marcy.
Hi.
I just started cleaning up a little bit. He's been shot with a shotgun, so yeah, it's
Okay.
already got a second bag of blood running because he's barely there.
Okay, I'm gonna put him under with propofol, and then I am going to go start cleaning and sterilizing this chest, and I want to see if there's any arterial damage or organ damage. I can already hear the rattling in the breathing, which is going to suggest a couple broken ribs, but my main concern right now is if I'm going to have bleed out. So let's go ahead and let's see if there is any organ or arterial damage. Excuse me. Oh my god. All right. Luckily, I'm not seeing any arterial organ damage. Looks like it's a lot of tissue, so we're going to have to do that rework whenever we start on the reparation and suturing. Let's go ahead. I'm going to clean and sterilize the chest. We're going to open up the side of the torso. We're going to get the ribs in a good place, and then we'll start on repair of the actual impact wound itself. Let's go ahead and get the portable x-ray machine over here, Tegan, and let's see how many ribs are broken. Let me get a sip of my water. I'm coughing all of a sudden. All right, we got 4 ribs that we're going to be fixating today. So let's go ahead. I'm going to slide that x-ray machine out of the way and let's get started. We're going to have so many medical reports.
Oh my god, what? Yeah, I was focusing on a guy in front of me. I was shooting him, and then I got shot behind with a shotgun.
All right, so first things first, we're going to resection the ribs. We're going to start sanding them and getting them ready to where they can be aligned as properly as possible. Let's flush the air and remove all shards.
Travis, would you be good if we rolled now?
Hello.
Yeah, if you're full, go ahead. I will follow when
Temple.
I can.
Temp-
Your arm took most of the hit.
All right, Tegan, if you will have me 4 Gemini rods ready, I would greatly appreciate it. Here, we're going to secure those with some pins. All right. Let's go ahead. Let's clean and suture this area, and then we're going to go to the impact on the chest.
CC her? Oh, I hate this bed.
All right, so we have tissue damage here. So what we're going to do, Tegan, is we're going to remove each thing, and then we are going to take out the damaged necrotic tissue, and then we're going to suture each one.
Can you see if these are these just bandaged, or do you know if they actually stitched her up? Let me see.
Sure, call.
Okay.
Echo 6576, EMT, 1 critical, 4 additional 47s.
Have them all go see Nancy first. They'll go into a bed afterwards. We'll tighten bandages and do any surgeries that are necessary. But all that are coming after this little round is seeing Nancy first.
A firm.
10-4. 5123, 23 Eclipse, 4 47s. I will take them to Nancy first.
If any do complain, put them in the bed and mark them as last for treatment. Because I'm petty.
It's not squirting blood, so it didn't hit
Make sure you're checking
main artery,
IDs.
but it just has
Coming into the hospital. The hospital's on lockdown currently.
Alrighty, there we go.
For treatment, just them coming in. Staff have to show IDs.
chest. There's also some GSWs. Let's see what happened here.
Oh, hey, boss.
Oh god.
Alrighty.
Looks like we've got internal
Tegan, are we thinking ICU, or are they going to wake up once they get fully recovered from this?
That looks really uncomfortable.
I figured as much. He's such a strong man. All right, let's go ahead and let him rest and let that blood transfusion finish. Hi, Rooster.
I can't seem to.
So what's the thoughts on
Dr.
doing
Mercy, it's
surgery
nothing,
when the main room's taken?
crazy, but you see my finger there?
Clear out one of the
Yeah.
You see how it's
private
missing the
ICU
end?
rooms and do it there.
Yes.
Okay, I got you. Thank you, Randall.
Yeah, I got it in my pocket, but it got hit by a bullet.
Get in a bed, Rooster. Get in a bed.
I'll be all right. I can help out with the cleanup, and then I'll.
Okay, once all this is done, I will fix your little your mini nub. Okay, your
All right.
nib. I'll get your nib done.
Yeah, I got it. I got it in my pocket.
Good. 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 Okay.
Okay.
Let's see what's going on here.
Oh. Shoulder fuck.
Took most of the vest, so a lot of bruising. I threw in through the shoulder. Let's make sure that not the axillary artery has been punctured. Damn, it's so good that these vests cover so much.
Yeah. I don't think they can take big weapons though. I don't want a shot by, but yeah. Oh.
All right, let's see if the axillary artery has any damage to it. Doesn't look like it's bleeding sufficiently enough for that, so we are going to clean that area first and get that nice and sutured. To numb. Alrighty, this is going to be done for about 4 to 6 hours. Gonna feel a little pressure there. It's just me just getting the damaged tissue out.
Somebody let me throw one up.
Blanket so I can see his face.
And snow reports up.
There's already a civilian report.
I took a.
This one's mine.
Took a radio.
Alrighty, now let's get some eye sleeves on this bruising to reduce the swelling, coloration. Tegan, if you will, go ahead and administer doxycycline, and we'll do a paracetamol for pain, and this one is done. Alrighty, there you go. Alrighty, what's going on over here?
Joke, man.
Fellow officer.
Let's give a look over.
Hi.
whether this isn't bad. No, I can only presume he's Elias, but I actually don't know for certain. Oh, God. Oh, wait, bracelet. Ah, it is Elias. Elias, no.
Erie, I love you so much, honey, but if I get sensory overload, I'm gonna kill somebody, okay?
I'm not even shouting.
I know, the hospital can be quite loud sometimes, though, lovely.
You hear me right now? Oh, mercy.
That's better.
Yeah, so that's your 95 bar. Rooster, which one did you take?
Alright, we got a graze ahead, we got a through and throw on the leg, and then we've got a bullet stuck in the chest. So, we're gonna look at the chest first, we're gonna flush it out and see if there's any arterial or organ damage.
The beanie.
It hurts.
Got bad.
I was still.
Are you like can't see anything?
Oh, I just. I want you to like pull me off the bed.
Is that better?
Yeah, if you can drop me. Yeah.
Luckily, this has just gone down to muscle, so I am going to go ahead and we're going to numb a few areas. We're going to do what's called local anesthesia. It's just going to cover a little perimeter around the chest wound itself, as well as the leg wound that you have. This means you're not going to feel anything that I do, but it's also not going to make you fully numb to where you can be incapacitated.
Get more drugs.
Not the good stuff.
These.
Okay.
Okay.
Can't find the one that was wearing.
You're gonna need to help me to stand up if you want me to stand up, you know?
I don't understand. It's different right now.
Alrighty, you're going to feel a little bit of pressure that is getting the necrotic and damaged tissue out so that it doesn't leave scar tissue behind for the next person that has to work on you.
That sucks. That feels weird.
We do it in the back room.
I have no idea what you just said. Alrighty, now to the leg area. It's a lovely through and through, so it's going to be a quick fix. Taking a feel, go ahead and Mr. Doxycycline and a paracetamol. Doxycycline for antibiotic, paracetamol for pain. Thank you much.
Hey, what bozo is next? You,
I
have
might have
you
got
been
a
seen?
Noise in my ear. If that's you talking, go fire away.
Alrighty, there we go. Elias has been seen. Alrighty. Look at you, all good to go here.
You've been seen?
Obtain some bandages. It'll be good for processing.
Huh? Yes, I'm asking why you are presently in a hospital. Yes.
Alrighty, that one is good for processing.
Hey.
That's alright.
Alrighty, let's see here. That means kind of nothing to me. Why is this erasing? There we go. Let's look over the injuries. So we're looking at severity. We're seeing if there's any arteries or organs that have been nicked. Hi, Jay.
What's up?
I'm not seeing any bleed that would suggest arterial damage. Let's make sure no organs have been punctured. Thank you, Jay. That is very sweet. Thank you so very much. Alrighty, no organ damage. So what we're going to do is we're going to do a regional anesthesia. So basically, darling, I'm going to numb your torso and your back, and then we're going to get all these lovely gunshot wounds sutured up, okay?
You don't. You haven't been Miranda. It's not on the record.
Black's not a color, that's a shade.
Yeah.
So, orange?
Oh, yeah, that's a good color. It's my third favorite one.
Alright, Tegan, I would love for you to administer doxycycline as well as paracetamol. Doxycycline is an antibiotic, paracetamol for a pain medication. I'm going to go ahead, now that we have the tissues removed that have been damaged, I'm going to go ahead and start suturing up the areas. We will then bandage with a compression bandage and wrap with gauze.
Oh, you got a banana right there. Yeah, I like red, number 1, yellow 2, and then orange number 3, because one time I drew a red line and a yellow line and it turned orange.
Do you like red because you like red apples?
Alrighty.
No, I like red because it's like, it's kind of like the color of the sun, but you gotta like, it's not like.
Gonna be in some pain tomorrow, darling, but just keep your paracetamol going.
Alright, thank you.
You're welcome.
The what's it called? The 3 rainbow theory?
Yeah.
Alrighty, lovely over there is ready to be processed. Let's see what I got going on here. Multiple gunshot wounds, all limbs, one in chest, none through and through, significant blood loss. Alright, Tegan, you're start doxycycline, O-neck blood transfusion, and we're gonna go with a slow drip morphine. Let's go ahead and get started.
Swam out to the middle of the lake, and I found out.
Let's see if there is any arterial or organ damage.
I thought it was the same one, but like a different one, you know?
On the pot of gold?
Yeah, well, I swam out to the middle of the lake, and when I got out there, I found out it wasn't a second rainbow, it's just in one.
Look at that. Femoral artery has been nicked. All right, let's go ahead and let's do a little cut to the back of the knee area, and then we are going to get that clamped, and we are going to do a lovely little synthetic mesh patch to make sure that we get blood flow regulated before we start on the other gunshot wounds.
You win some, you lose some.
Let's put the patient under propofol.
You rubbed an urn and you had 3 wishes.
Dr. Grace
What would
41.
the wishes be?
We have lovely patients in the observation area that need treatment.
You can't have more wishes, right?
Alright, 2 seconds to change.
Alrighty, that's why we wear scrubs. Alrighty, look at that little spurter. Alright, let's clamp.
Because then it's like an infinity like money glitch, you know. You just keep coming back for more.
Alrighty. Let's go ahead. We're going to do a synthetic mesh patch. I'm going to go ahead and utilize my Da Vinci machine because there might be one on the underside of the artery as well. We'll assess once we get in there.
I'd like to go back in time and meet Mr. Miyagi. Never got to meet him. Number 2, I'd like my sister Robin to live forever. And number 3,
Alrighty, now what I want to do is laparoscopically, let's just look at the underside of the artery and see if there's any laceration that's going unseen.
10-7 for a few minutes.
And it is not there. We are going to unclamp and make sure that the blood flow is regulated. In 3, 2, and 1. Bam. Unclamped artery. Thank you, Jay.
by Nancy, but I don't know if he's been seen.
Alrighty. So let's go ahead and we'll start an O-neg blood transfusion. What's next to 15%? We're going to start another one. We're going to do 4 total bags today. Alrighty, let's go ahead and let's start on the gunshot wounds themselves. We got the artery repaired. Now we're going to get these that have been lodged. We're going to follow the natural trajectory to where we don't cause any more damage. Once we get all the bullets out, we are then going to remove any necrotic and damaged tissue. That way there's not scar tissue for the future doctor that has to then do surgery on this lovely, lovely patient. And then we are going to close them all up with sutures and compression bandages. Let's go ahead and get started on that portion. Tegan, if you want to take the bottom half, I'll take the top half and we'll get all of these done.
The one in the back of the ambulance.
All right, Nancy, while me and Tegan get these out, I want you to go ahead and I want you to administer a level of doxycycline as an antibiotic. I just want this concentrated to where we don't get any infection since foreign objects have been within the body.
Did this start on
6576 late.
Alrighty, let's get to sewing all these holes. Alrighty, gonna go ahead. I'm gonna fix a compression bandage and we're gonna wrap in gauze. Alright, Tegan, what are we thinking? Do we think that this is gonna need ICU or will they be able to be processed soon?
You have a coffee machine? I think we need a coffee machine here.
Alrighty, perfect. We're gonna let that transfusion finish up and then she'll be able to be processed once awake and cognizant. Alrighty, darling, let's just go ahead. Let's tighten every last bandage and then it will be good.
Just gonna get a couple bandages put on here right quick.
There's a bullet in this guy's ass.
Leave it in.
How you feeling?
Alrighty, we are good to go. Like I said, we're just gonna let them rest. Their body temp will get up. The blood transfusion will help get that strength back. Then you'll be good to process them.
Sounds good. Thank you very much.
You're welcome. Did you ever get your little nib fixed, Rooster?
I've wrapped up the back of his head. It was bleeding slightly. Administered fluids. He's on high flow oxygen. His breathing was labored and heart rate high. He's stable for now.
Alrighty. Tegan, if you will, let's go ahead and wheel that nice portable x-ray machine over here and let's see just exactly what all we have going on.
I got him in a seat collar as well. Right arm all twisted and funny looking.
Okay.
I've knocked myself out 15 times now. I don't need to do it a 16th
All right,
time.
definitely have a skull fracture. We'll see to that when we get to it if it's going to need a craniotomy. Okay, let's assess the chest and the arms, see if there's any ribs broken or arm fractures.
To go 1042.
Okay, right arm has a complex fracture there. That's going to need a fixation. Let's go ahead and get a Gemini rod ready, Tegan. See about ribs and any legs if that's broken. Alrighty, no ribs, and now let's assess legs. No legs broken. Alrighty. Alrighty, Tegan, if you will, let's go ahead and administer propofol to put him under. I want a doxycycline. I also want a slow drip morphine. Let's do 1 O-neg blood bag just simply because of the blood loss from the breaks. That'll help stabilize and maybe get some of these vitals in order. Also, let's push a little metoprolol to help with the blood pressure. It's being a little bit erratic with us, and we are going to go. We're going to go ahead and we're going to start since we know the arm is complex. That's fine. Let's start with the head. I want to look a little bit closer at this image and see if it is hairline. If we need to do 3 things, we have 3 options. One, we can simply do a mannitol to reduce the swelling. We might have to do a slight incision and do bone wax to help with the spidering fracture. If it's a little bit more complex than that, it's causing pressure in the brain, we might need to do a burr hole, drilling a hole into the back of the skull. Or if it's even worse than that, we might have to do a bone flap, removing a portion of said skull. So let's see which of those three options, medicine, burr hole, or bone flap, the last two being surgery, is going to need to be done here. I'm so sorry, guys. I've got a cough all of a sudden. Alrighty, looks like we're going to be doing a burr hole and then we'll be using bone wax on the spidering fracture. So we're going to go ahead and start with that piece. Now that he is under the propofol, I'm going to go ahead, I'm going to roll him to the side where we're going to prep the area. I'm going to do a deep part in the hair. We are going to shave and sterilize that area for our incision.
EMS from PD. Is the fire truck EMS lady around with the big yellow helmet? Just she held one of my
Alrighty, let's
suspects'
go
guns and
ahead. And
he
now that
feels
we
very
are
attached
prepped and
to her.
ready,
Doesn't
we
wanna
are
let
going
her
to go
go.
ahead and make our incision.
Could you just come and tell him that? We're right next to the Ward D. You're just gonna
So
have
we're
to
going
let
through
this
the
one go 'cause
epidermal and the
now,
muscle layers here. If you will, let's go ahead and give me the drill, please. Maybe creating a small
Yeah,
hole
you did
about the
great.
size of a dime through the skull. It's just going to get us exposure into the dura mater, or, you know, the brain's outer membrane.
All right.
Alrighty. Let's go ahead. We're going to make an incision to the dura, just gaining access to subdural space.
Yeah, you can't just ask for more wishes.
And then we are going to go ahead and utilize our suction device. Let's go ahead and get that accumulated blood and fluid.
I'd wish that somebody else could have the wishes so I don't have to decide.
Alrighty. Now, Tegan, in your thought process from what you're seeing with your laparoscopic camera there, do we feel like this drain is going to be enough, or do we need to place a drain in there for 24 to 72 hours to allow continued drainage?
Sam, could you stick a plaster on my finger?
Alrighty, perfect. Let's go ahead and let's do an administration of mannitol, and then I am going to go ahead and we're going to fill the burr hole itself. Basically, what we're going to do is we're going to use bone wax to fill the hole, as well as the spidering that we're seeing from the fracture line.
Get you a little bit of a look on aesthetic.
Thank you.
If they're not coming, then you're probably just gonna take a nap.
Alrighty, let's go ahead and let's prep the area, and we're going to suture the back of the head.
It'll wear off momentarily. Alright, I'm just gonna check. Are you able to still move your arm okay?
Yeah, it's just it feels a bit stiff and tight, is all.
Alrighty.
I'm just gonna check the internal.
Now for the arm.
Okay.
You get shot.
Oh.
Now let's see what bone we
Yeah,
have down
Alright.
here that has been
Yeah, it's just
fractured.
All right. I'm glad you're okay. I don't want to
you
be
take-
anywhere near this bed because this bed is.
Can you just reach into my duty belt and take the 4 fucking heaping bags of evidence that I've got and chuck them
See
in
if
the
it's
back of the truck,
radius,
please?
ulna.
Well, now screw up chain of custody of evidence.
All right, looks like we've got a little radius. I'm gonna go ahead and we're gonna make an incision going along the underside of the forearm. Alrighty, so first and foremost, let's clean the area of any shards and debris.
Thank you.
Alrighty, let's go ahead and let's prep the bone. We're gonna go ahead and reshape it for proper alignment.
It feels so weird when it's numb. Because I know it's supposed to hurt.
Just the pulling on the skin and things, especially when it's close to
Yeah.
your head.
Alrighty, if you will, Tegan, let's go ahead and get that little rod ready for me. We're gonna cast afterwards. Alrighty, I'm gonna go ahead and I'm gonna remove chronic cutaneous tissue. I don't want to see a lot of scar tissue building up. That will help both with inflammation on the arthritic side as well as for future surgeries. What I want us to do is once I get closed up, if you'll do a thin layer of gauze and start mixing that plaster for the cast, I would greatly appreciate it.
Still stay on use, but this will help with the pain after this slight local wears off.
Thank you, I appreciate it.
Tiny poke.
Thank you.
Alrighty, let's do a thin layer of gauze. I'll just
Yeah,
keep
just
from
so-
irritation with the cast on. Hopefully reduce the itching and discomfort.
Could I ask you to press down on the end of my plaster so it squishes? Because I'd do it myself, but
Why is it squishing?
well, it's just like, you know how like the plaster's not round, it's square. Yeah. But I cut my fingernail funny, and when I
There we
push
go.
it hurts.
Now let's go ahead and get everything else cleaned.
So why would I just push it on your finger if it hurts?
Just to make it more round, like if you just flatten the corners down for me.
Okay.
Rooster, are you wanting to look like E.T.?
What?
Like just have a little ball at the end of your finger? Or...
Yeah.
Okay.
Just fix that for you right quick.
Is the hospital locked down right now?
No, the FIB is doing whatever the FIB does. It is not locked down.
Better?
Yeah, it's not anymore. I told them to, stand outside because they were like guards. Fuck, I don't know the English word. Guards? Question mark. Security. That's the word.
Alrighty. So, what are we thinking here, Tegan? Are we thinking observation overnight? Do we think that he's going to wake up very, very soon, or do we feel like he's going to need to be in ICU? Alrighty. Let's go ahead. Let's get him an observation.
Alright, I gotta take good transport here.
And then we'll get this medical report added to our growing list of needed ones. There we go. Let's go ahead and spread a thermal blanket over. Make sure our IVs are all connected properly and that his vitals monitor is hooked up. We'll go let Bryce and Eddie know that they can come visit. We'll get this medical report typed up. So many reports. Oops. Sorry, Rooster.
Dr. Mercy.
No, I saw you left it
Okay,
completely raw.
he's an observation if y'all would like to visit him. I'm sorry, what, Rooster?
Oh yeah, sure.
It still feels like I got an injury on my finger.
Okay, let me look you over, darling. I'm just gonna shape this. Darling, you have so many loose bandages. You're like a mummy.
But I don't have kids.
Not a mommy, a mummy.
That's the same thing.
It's not the same thing.
That's what we see in Britain or something.
Hi, Mercy.
Hi.
Max cut my BBC tattoo off, and now I have a gaping wound.
Oh, kill him.
No, I mean, it had to be done.
I don't know if that's fair enough.
I mean, I don't know.
Alrighty, ET finger and
Alright.
band just tightened.
Thank you, Dr. Mercy.
You're welcome. All right, let's go look at your gaping hole.
Dr. Madison told me
Alright.
to make sure that
There
it
we
wasn't going to get
I might as
infected.
well just hold on.
Okay.
Yeah.
This happened last
I'm
night,
just-
or?
Oh, just a couple hours ago. It's fresh.
Okay. So you hopped in
I'll
bed
take my
here.
shirt off for you.
Okay.
Yeah.
This girl, like, always hits on Mercy on every character. Alrighty, let's see what we got going on here.
Yeah.
Oh, darling, your tit is horrible. Alrighty, let's go ahead and let's get this fixed. I am gonna numb the area, by the way.
Yeah, you know where like the little lip bullet tattoo situation used to be.
Yeah, I got
I
you.
mean, you know, there's a hole now, so of course you know.
No worries, lovely. So this is gonna be numb for about 4 to 6 hours. Okay, you're gonna feel slight pressure. I'm just removing some necrotic and damaged tissue from the area. Alrighty. Taking, if you will, let's go ahead and administer a shot of doxycycline as well as paracetamol for pain. One is an antibiotic. Then go ahead. We're going to start some closing. You're going to get about 4 sutures today. So a lovely little scar across there. It's going to look like it's biting its lip instead.
Like a what?
Like a bit lip.
Oh.
Alrighty, lovely. I am going to place an ice pack to help with the swelling and the bruising around the area. You're going to feel worse tomorrow. Make sure you change out your bandages, please, so it doesn't become infected. Nobody likes an oozing boob.
No.
Alrighty. You are good to go, but take your time if you need a rest, okay?
Okay, thank you.
You're welcome, darling. I just want to get my reports done. USA, what can make me feel this way? Hi, Frankie. I just want to get my reports done. I think I'm getting a chest cold or something. My chest is feeling hollow. It is making me cough. It just came on like all of a sudden.
EMS from doctors.
San Famous.
Is there anybody free to transfer a patient from Eclipse to the Grapeseed I see?
Seems like what should have happened, and this is just for future reference, because sometimes you have to advocate for yourself as a patient, okay?
Okay.
There's steps
well, they
to
did give me a brace, but I have
Well,
to take care of things myself.
Okay,
I
so
don't-
there's steps to a dislocated shoulder, all right?
Okay.
So usually what will happen is
Mm-hmm.
we'll try to numb the area a little bit because it can be a big shell shock when you get just relocated, because basically we're popping the bone back into its socket. You have a ball and socket joint there, right? So typically what happens is we numb the area, we apply pressure on both sides, we pop that sucker back in, and it's painful. I'm not gonna sit here and lie to you.
Well,
But
I got okay.
but afterwards, they should be like giving like a cortisone shot, because you're likely going to have inflammation that is set in that needs to be dissipated so that the relocation actually sections its way the way that it needs to. Otherwise, that inflammation is almost going to serve like a barrier, which could be why it's still popping out so easily, is there's not any of that dissipation. So it's almost like the joint's there, but it's not as secure as it could be. And then they should be placing you in a sling, because you don't want that mobile after being relocated.
I know they put me in one, and I'm just like, I have to drive. I got to take care of things, you know. I can't.
Well,
tied
but
up.
but you kind of have to, at least for a little, because you could drive one-handed, but if you're not allowing that through its healing process, especially the decrease in inflammation, you're gonna fuck your arm up. And like I said, you might need surgery, but I'm just telling you, shoulder surgery is nothing to scoff at. It fucking sucks.
Yeah. All right. I'm just, I have to work, and I have to drive all the way to Grapeseed to go to work. Because I got the job with Grapeseed.
Which job is that?
Administration
Okay.
worker. And I'm Dawn's assistant now.
Okay. I mean,
She
if
said,
you
okay.
You know that if you talk to Harold and Dawn, they have barracks there so that you live maybe a little bit closer. Dawn also has a treehouse that she sleeps with cats at.
No, I won't be there. Wait, I'm sorry. I know. I come here to drive taxi too because that's the only way I make money, it seems like. So, until I get
4 hours trying to help them figure it all out.
How you
And
doing?
try and fix all these ambers.
Gosh,
that
it's
were
a crazy
broken.
morning.
I
We're
know it
already
sounds
starting with
like a
Mercy
lot of
having an
excuses.
appointment.
And
She
I
just had to
need
go
to
help
stop
with
hurting
radiation
There'll be a way.
poisoning.
That we should be able to take it in the
So we're
lab
gonna
and
jump
they can fix
right into
something
everything.
and come to something
Good morning.
wrong.
Right.
So trying to go pay Benny's probably a lot more than
Can I have
it would
like
cost
at
at Hayes.
least an ice pack because I did run myself over before.
Yeah, we can give you an ice
Alright,
pack,
let's
but
get
do you want to get
started.
a CAT scan while you're here and at least like a cortisone shot?
Okay, I could do that.
Okay. Let me just get here. Okay, no loose bandages. All right, let's get the ice pack placed on there. And give me one moment. I've got to pop in the pharmacy. I'm going to get some corticosteroid shots.
Hi,
and
Dennis.
then we're going to take you in for a CAT scan. See if the
Hi.
inflation's set in so bad that you do need
Hi,
surgery.
Howard.
If you don't need surgery, I'm just going to get it fully treated and put you
You
in a sling,
ready
okay?
for some scans?
Okay. All right, give me just
As
one
our
moment.
library, let's do this.
Okay, first thing we're going to start with is we're going to go back to triage. I'm going to
Actually,
do a
need a
quick
few shots
EEG.
anyway.
So just looking at the electromagnetic pulses of your brain, see if there's any slowing or anything there that would be of concern to me.
Cortisone.
Then we're going to jump into the MRI and look at the
Medium,
actual imaging, okay?
syringe,
Okie dokie.
Cordae,
Alrighty,
is what
come
I
on back with
call
me.
it. Administer to decrease inflammation.
How's your day going so far? Submit.
Oh, my joints are a
Have
little
5
sore,
of
but otherwise
these. I
okay.
need doxycycline.
Why are they so sore?
It's just,
I always do a
early
low
morning,
and a
waking up out
high.
of bed, that kind of thing.
Because the high is what works on the gangrene
Okay,
infections.
hopefully
that gets a little bit better for you.
Administer for
Indeed.
infection.
But, I'm also 75, so.
Nope,
True.
uphill.
Right.
I'll get you right up
There we
there.
go.
Okie dokie.
5. And let's do a high dose. I probably need more mannitol.
Alrighty. What was I thinking of? Doxycycline.
No, I'm good actually. I feel way better now.
Cycline. Administer for infection. High. Syringe. Submit. 5.
I need an antihistamine. I know that. Oh no.
Benadryl.
Alrighty, we're just gonna
Administer
let this do its
for
job, and then we'll go into the
allergies.
scanning process.
Okie dokie.
Do I have not enough space? Fuck me, the spoon. I got rid of so much shit.
The gun and might as well give me the finger.
Give me this. All right, there we go. Let's dispose of shit.
Type out a diagnosis.
Early activity, temporal lobe. Temporal lobe, okay. Moving with temporal stuff, hippocampus.
There we go.
Get rid of these pills. And this, and the rest will go in the trash can. All right, darling, follow me. Let's get you back for a CAT scan really quickly. Soloing. Let's go ahead. We are now going to go in and do a scan. I am going to let you just walk with me. We'll go this way.
Yep.
And it exploded.
All right, come on in here. And I want you to lay on this table. And this is going to be able to show me scans of not just the skeletal system, but also the muscles, the tendons, and everything else. So we'll get a good
Alrighty.
register if something's going on underneath, all right? So let's go on. Not in here. I want my MRI machine. Over here in this next one, I'm going to have you lay on the bed. Howard, do you know of any metal plating you have in your body, anything like that? If so, I want to make sure we use CT instead of Just
MRI.
peek there at that bed.
I was gonna say, I think
You'll
like
hop on it.
95% of my body is like metal now.
Okay.
I know they did something to my femur and kneecaps. I think they like made metal bones.
Mm-hmm. If you just peek at it,
Otherwise,
you
and
can
I
use
don't
it.
remember what else is in there, but I know for sure that's the most recent thing that happened to my body.
Thank God
Like
this is
part terminated.
obviously a CT machine, am I right?
Yeah, no, I mean it says CT right there.
Exactly.
Yeah.
All right, let's get you in here and let's get you fully scanned. There you go. All right, lay still for me. We'll get these images. Listen, we make it work. Let me look and see just exactly what's going to be our approaches here. Let's say how severe. Surgery or will medicine? Because damage really can't be reversed from the temporal lobe. He's just going to have to do neuroplasticity, basically. Alrighty. Images are starting to come in. Damage to the shoulder, like it was broken butt. Old break. Okay. Will it require mild contusions consistent with trauma from a high velocity impact? Surgery? It's gonna be more of cognitive therapy than anything. Not sure, maybe. Okay, I don't know what to do with that answer. Okay, that doesn't help me. Okay, so I tell you what, a few more. It looks like you
You're doing
have an
great.
older fracture. That the way that it healed was a little awkward, which is probably causing some issues there. So what I'm gonna do is I'm gonna give you a corticosteroid shot
2 hours, so it's a little
into
bit
the shoulder.
hard.
You're gonna use a sling.
That could be pressure.
If that doesn't alleviate it, we're still seeing pop outs and everything else. We might have to do surgery, but we'll keep monitoring over the coming days. Okay.
Pressure.
How long has this been going on for you, Howard? Corticosteroid shot.
Oh, geez. Since I woke back up in the ICU.
Where's my cord aid? How long ago was that?
Oh, geez.
Alrighty, there we go. Just give that about like an hour or two. You should see some alleviation of pain and pressure, okay?
Okay.
All right, darling. Like I said, just keep monitoring over the next few days. If you start seeing like dislocations again, let us know, and then we might have to proceed with surgery. Break it again.
Okay. Thank you.
You're welcome.
Can I ask you a question, Miss C?
Yeah.
The 17th,
Yeah.
I want to say.
We're gonna have. Okay.
I know.
Did they do a scan before they released
to
you?
Dr. January for therapy, and
I
there was
wouldn't
another
remember.
doctor that
It's okay.
was
It's okay. Let
referred
me
to
just look at your chart really
Dr.
quick.
Pendragon.
Okay.
And my old therapist told me, to shop around.
Mm-hmm.
And I want your honest opinion. Who do you think would work better for,
Oh, there wasn't anything
grief
to the
and trauma?
head.
Or should I just talk to them both and pick?
There we go. Pressure was relieved.
I
on
mean,
the
feel free to
brain.
check out the psych team. Pendragon's a counselor, so he cannot prescribe medicine. That's just one to think about if you've ever had to go the medicinal route, but he can
Okay, frog
refer
them and see what direction
for
he wants to take
medicines
it.
to be filled.
I asked that
So
because
if you wanted to
okay,
try
so I'm gonna
Pendragon,
tell you what I'm seeing and
yeah.
then what I'm continuing to look for.
Dr.
Okay, it doesn't
January
mean that
good?
it's gonna
I mean,
show,
just
but
give
it's
me
Dr.
some things
January
that I
is
wanna
very
rule
good.
out.
Yes. He's very unbiased. He's going to be
So,
very honest.
You have contusions on your temporal lobe, so basically like a bruise on your brain.
I mean,
Okay.
I do like him and everything.
Typically,
Just my
what we would
there,
do
it's
when
just
that
hard.
shows
I
up
hate retelling
is
my
we would
story
treat
over
with
and over
mannitol, which looks like what they did
Yeah.
whenever they
No,
did an
I
intake of
Dr.
you.
January is one that won't fuck around.
That
which
reduces
is a style that
swelling
I respect
on the brain and takes care
I
of minor
don't.
bleeding.
I don't like hand holding,
Typically,
coddling
before
kind of
dismissing, when somebody has shown
therapy,
a
but
little
that's
bit of
just
brain
me.
swell, we want to do a follow-up MRI because if there is still spots that are
they
showing,
have
that
it,
could mean
so,
that there is enclosed pressure that needs to be relieved by either
my
a
old
burr hole,
therapist
where we do
really
like a
didn't
small hole to
either,
the
but
skull,
I'm
or a
kind
bone flap. By taking that off, it's almost like deflating a balloon. It relieves the pressure to where the brain activity can work again, and we
Yeah,
can
no,
also
I
take
like
care and
Patrick.
like
Patrick's a good
suction
one.
any bleeds, any CSF, which is spinal fluid that is built
Okay,
up,
Sergeant Rescue
and kind of
Card.
like
Good
restore
to
a
know.
little bit more of normalcy. I don't see where a burr hole
absolutely, no
or
worries.
a bone flap was done.
Like I said,
but
don't
like I
ever
said,
be
it's
afraid to
usually
shop
72
around.
hours.
It's
So what I'm
I tell
looking
people
for
that
here
one big
is,
thing about your
and I
mental
don't wanna
health is
scare
the
you,
person that you choose to walk through
is
it
this
with.
going to
so.
be irreversible? Is it not due
took
to
me a while to
pressure and
find the one I
swelling
had in
on the temporal lobe area?
Yeah,
And
it's looking
therefore
for
we're
right
gonna have
fit.
to look
thought-
at more
yeah,
cognitive
I'm like,
therapies, meaning
you know, I
more
talked
of
to all
like
these, no
coping
offense, but I never
therapies
wanted to
to
talk
help
to a male
you
doctor. I know that sounds really
learn
bad.
different
But I
techniques
end
for
up
memory.
finding my fit,
So simply
you know,
because when we
from my
have
old
damage
doctor,
that
Janice.
isn't due to like the pressure,
He's
the
like,
brain,
no,
the brain
I
swelling, the
love
bleeding,
talking to you,
that's
Olive,
going to be
but you know,
irreversible.
you moved out of
Or
Virginia.
is this a case
you
where we're
know,
having
I
pressure
found
on the
one
temporal lobe, which is
there.
what I'm looking for right now,
It's kind of
to
hard.
where then we do a burr hole or bone flap, relieve
Yeah,
it,
grief unfortunately is not my
treat it at
specialty,
its
but that's
source,
mainly
and then
because
within
I
the next few
deal a
days,
lot
you'll
with
start to see if
gangs
we're
and
getting
serial
into that
killers
memory
and crazy
process. So
people
that's
where I
kinda
just
what I'm
say,
looking for
fuck the
is
fuck
Avenue
up, or I'm
1.
going to slit your throat kind of
Unfortunately, is it
therapy.
not due to brain swell
So
bleed, to
grief
where
is
then
not
you're just gonna
typically
have to learn
my
another coping mechanism, which is worst
forte.
case
Well,
scenario. Doesn't
my
mean it's
husband
impossible.
was killed by a
Very
serial
much able to do
killer,
so.
so
Or
Yeah,
is
I
it the
would
fact
probably
that,
talk to the
yes, we
person
can
that killed
surgically
your
treat
husband, you
this
know,
and
like
make
I'm
it better
that kind
for
of
you
therapist.
within the next few days?
I don't even
Okay.
know what happened to that son of a bitch. So,
Okay.
you know.
Hi, Wicked.
My
Sorry, I was right in
husband
the
made
middle of
it
an
easier
explanation.
compared to his other victims. You know, he just got shot between the eyes. It's awful. I hate them all. You're right. They're a bunch of cowards. Bunch of cowards.
I just want to
Okay.
honor
I bet
his RP. I don't know what he's
you
going to
have
do
the
with
stomach
it,
of
so we're just
steel.
gonna see.
That's all I'm saying. If you can work with them kind of people.
Well, you know, I get my hands and guts every day.
Yeah.
Yeah. But no, everything
Well,
looks good, so we'll see. We'll see
Yeah.
how it progresses.
Thank you, doctor.
Yeah, absolutely.
Way out. I'm so confused.
It's
Oh,
it's
there
just just that way and to the right.
All right. Thank you. Have a good day.
Yeah, you too. Mercy is
That's
hella
one thing I
big on
try to
people
do
should
is I
shop
try to
around because I
just-
keep trying to
I
explain
try to
to
be like, okay,
people,
here's some
especially
options
for their
that
RP
from a medical
purposes, it's
RP
dependent upon
sense
what they
make
want.
sense.
Because, like, okay, let's talk about like our therapy team for a second. Okay. So usually, what Mercy
All right,
tells
lovely.
people is you have
I've got what I think is
Leslie
good news,
and
but we're
Anna
gonna go
that
into one
have
of the
that more
consultation
clinical
rooms to
side.
discuss,
They
okay?
understand the proper diagnosing, testing, and those kind of things. So if you truly want to
All right,
like
come on
delve
with me.
into the clinical side of working through it, go with them. You have Ember and Pendragon, who, in Mercy's opinion,
goodness, that machine is very
coddle their
loud.
patients.
Yeah.
That's not effective for Mercy. She feels like that's a little
Alright, right in
enablement, but
here.
some people really need that soft approach. So she suggests people that are a little bit more emotional to go to them. Patrick specializes in LGBTQ
Chairs could be a
and
little bit tricky, which we
PTSD.
can also stand. You don't
So
have
she
to if you
utilizes
don't
him,
want
plus he's
to.
honest. So she
That is
knows he
completely
can
up to
balance
you.
that being very sweet portion of it to also being very straightforward.
Alrighty, so
Mercy
with the
is the
scan,
kind, and this is why Mercy works better
there is
with
some swelling that
gangs
is
and
present.
violent people. Mercy's
So
the kind
we
that's just
can
like,
go in and we can do
you're
a
just making
burr hole,
excuses. You need to shut the fuck up and
relieve
move
that
forward.
pressure,
It's also
and
why
it's
Mercy
going
works good with the
to
cops
help.
because Mercy can kind
You
of
might still need to do a
plow
little bit
through
of cognitive
them.
therapy.
So
of just like
everyone in the
getting some
department has their
tools
specialty,
for
and I keep
uh,
telling everybody, I don't think
memory
they
and,
understand like
object
how
retention, that
much
kind of thing.
who you
But,
choose.
I will say the surgery would
as
help
your guide on the
immensely.
side, because that's what I see therapists as. Is they're just guys on the side. We are
Okay, so how,
background
like,
players in your RP arc
What's the
of
risk of
whatever
that?
you're trying
Is
to
there,
do
I
through
mean, surgery has
therapy.
risks, right?
It
every
is
surgery
so
has risk.
important.
I'll
who
be
you
honest
pick.
with you.
That's
I
whether that's
do
going to be a good
craniotomies on the
interaction or a
daily.
bad interaction.
I'm very,
and so
very
Mercy tells
skilled
me all the
with
time,
it.
you should check out other people.
Of course, I mean,
don't
it's gonna be in
and,
your brain.
and
Burr hole's
Mercy
gonna be
will
less
not do therapy
invasive.
on her friends.
Basically, what I would do is I would drill a hole.
She tries
and
to
then
pass
laparoscopy
that
would
to
go
other
in and we would
people
handle any
because
hematomas, bleeding, CSF.
she'll say, I'll have
pools
friend
that we're seeing,
conversations with you,
get those suctioned,
which are basically therapy
the
sessions,
hole
except
itself,
she's not
like I
their
said, acts
therapist.
like
She's
you're
just their
deflating a
friend.
balloon.
BC!
It's gonna alleviate that pressure, give you a concentrated dose
You
of
did
mannitol,
not have to do
and
that.
then
Thank
seal you up,
you.
use bone wax for the hole.
That is so
close up the
sweet.
area,
You
you'll
did
have a
not
little
have to
small
do that.
scar,
Oh, and yeah, I've got my
and
new alert up.
that's the process. You might stay overnight in the hospital, just for
my little kitty
observation and making
You
sure
did
that
not
your
have to do
vitals
that.
stay
It's
okay.
very appreciated,
I
but not
do these
necessary.
pretty regularly.
But yeah, Mercy's a huge advocate of please shop around and also understand what you need, not what you want, but what you
Yeah,
need
I mean,
in a therapy.
whatever helps.
I know it's
because
a
you have a lot
lot.
of people that just
And
kind of
aga-
want to be
again, hearing
supported, and
brain surgery
sometimes
can be very scary.
Sometimes that does
the good
more
thing is
harm
you
than
don't
good.
show any signs
And
of
so
masses.
you need to have an
You
understanding of
don't
what's
show any
actually
sign of
serving
cyst,
you.
Which is good. That is good.
What is
okay?
this? I've used my chair
And
so
you
much
have a good
today. I
chance of
don't
this
believe
being able
him.
to be fixed through surgery.
Hi, Jessica.
And
I don't believe him.
a lot of people, unfortunately, when
Why
they hear this
don't I believe
diagnosis,
you?
it's irreversible because too much time has passed, and they just have damage to the temporal lobe that can't be
Oh my-
alleviated.
Okay, no. Crash. That's very sweet of you,
Yeah,
but you
I mean,
all
I
do
would
not
like to,
have to do
be
this,
able
you
to remember
guys.
shit
I
again. It's like my
appreciate
brain
it,
is trying to put together
but
like
you
a
do
thousand
not have
piece
to do
puzzle,
that.
but it's all
There's
Thank
pressure.
you.
It's definitely
You
building
don't
around
have to
that,
do
and it's
that.
and so it's almost like
Thank you,
inhibiting
though.
it. And once we go with that burr
Very
hole,
nice.
I would say
We all do not
over
have
the
to do
course of
this, so
72
thank
hours,
you.
you're going to be like, oh my god, wow, I feel like I can think.
Oh my god, you're a
clearly.
lifesaver. I will do that. Okay, she's
That'd
gonna
be
make a
nice.
strawberry tart. Joe loves food.
Now, like
so-
I said, it does put you overnight
and it's
in the
it is his
hospital.
birthday.
When would you like to schedule your surgery?
You do not have to do that, but it's very thank you. Very
Um,
nice. We're helping Iridescent, and it's his birthday, the 8th.
Hmm.
Guys, I need to think of actually a present for Mercy to give Joe, but I want something that I feel like
Let's
Joe
go
would
ahead.
like.
And, can we do it tomorrow?
And I don't know. He likes
I mean, the sooner
guns
the
and
better, right?
cars and just manly
what time
stuff.
tomorrow would you like?
Fire
So I
17
don't know what
from
it's gonna
Echo
be.
96.
Say this time tomorrow.
Send it.
What was I gonna
Pick
do? Oh, I
me
need
up
trash
from,
cans
Trauma Center,
because I have
please.
food in my pocket.
I'll make my back up there. Hold on.
Yep, that should work for me. It's a
Yes,
quick
that's
surgery. I'll be honest with you. Surgery itself
Dun,
lasts like
dun.
On my
less than
way.
10 minutes.
Done.
Appreciate it.
And then you'll be in the
I'm
recovery
returning
area
to
for
search
you,
and
okay?
rescue car, and I went way back
Sounds
down.
good.
Okay. Yeah.
A car with a
so
gun
meet me
built in.
here
I need to think of
tomorrow.
something.
Only need the bed.
Again,
I was thinking of like a
I
little
know
book
that
with
it's-
like
it
the
can
history
be
of guns
very
or something.
nerve-wracking.
Hi.
But
And maybe
I
utilizing
promise you,
that
I do
as a
so many of
gift.
these in a week, and you're in good hands.
Oh God.
And then, so you said something about like
It's my
like
second
post,
one.
you
I
know,
bought a new
there's
one today.
tools and therapy and such. I mean, what does that look like?
So
Yeah,
basically,
this is my
it's
second Solon. I've
more
got
of
another
doing
one stashed away
exercises,
somewhere.
teaching you different things to help build up your memory to strengthen that.
No, I saw the word
So it'd
salt.
be more like photo memory, recollection. I tell you a short story, you tell me facts about the story back to me. It's more of that.
Fucking Jimothy.
Gotcha.
I kinda
Okay.
parked my car on top of a policeman today as well, and I think they died.
Well,
I don't think
at
I
least
put my
there's a
hand
light
out
at that end of
today.
that
I
tunnel.
didn't.
There's a
I'm
light at the
so
end of the
good.
tunnel, yes.
It was someone with
Okay.
a helmet from Grape Seed.
So this time tomorrow then.
Yep, this time tomorrow.
Favorite
Look at y'all.
brains. Sounds like a little bit of an odd one, but we'll see. There's so many serial killers right now that Jesse, it reminds me of the pets. It reminds me of Hostel. Mercy's kind of over the serial killer RP. There's so many going on right now that I'm just kind of like, eh. Hi, darling. Is she acting like she can't? Okay. Sorry. All right, I'm gonna look you over. I'm gonna start with vitals. We're gonna look at heart rate, blood pressure, and breathing. Basically, the hospital. I'm so over this because there's so many serial killers right now, and I'm just like, eh. All right, so everything is slightly elevated, so we are going to give a little push of some metoprolol just to help kind of bring that down. Definitely don't want to see the pulse that high. You need some more pillows. You wanting to change? Okay. No worries. Me and Tegan can take you back there and assist with you. Just 1 second. Let me finish the checkups and then we'll do that. All right, that metoprolol should help with the pulse. We've got the 3 intravenous lines. I'm going to go ahead. I'm going to remove the bandages from around your mouth area. I'm going to make sure there's no infection. We'll get that redressed. I need you to breathe. You're safe. You're in a hospital room. You elevating your heart rate right now is not going to help anything. Mercy, stop that. Having a panic attack? Stop it. All right, I'm going to go ahead and I'm gonna clean the area. We're going to get fresh bandages on. Alrighty, now we're gonna look at the stomach area. I'm gonna take these bandages off, looking again. It's very same thing. Just make sure that we don't have any infection going on. Alrighty. Healing, slow but healing. Not seeing any signs of infection. Same thing. Gonna clean, I'm gonna redress, and then we'll go and we'll change your clothes. I'm not looking forward to the marathon trials. Me either, because I know on medical stuff, more than likely Mercy will be called. Because she can speed run through that shit. I'm going to check your Achilles when we get back in here. That's a little bit more of a different horse, darling. All right, Tegan, help me. I want to move the IVs over to a portable stand because we need to keep those on her. We'll disconnect the vitals monitor just for right now. And let's go. I'm one, I've said this before, and this is my hot take. I hate scripted RP. I hate it. So if you're gonna do serial killer RP, I prefer it to be methodical, more tension building than gruesome or like shock value. And I like it to have a nice ending plan in place, but yes, reach out to the people and be like, are you good with being a victim? And outside of that, don't script anything. I'm gonna place you in this nice little chair here, and you'll be able to get assisted by Tegan to change.
X-ray through 31041.
Okay. Are you ready? Okay. Turns back respectfully to watch him here. Well, yeah. But yeah, no, I'm fine with serial killer RP as long as it doesn't drag and drag and drag. But I don't like when it's overly scripted and coordinated by everyone involved. It's just not my favorite. Like when the victims know they're getting attacked and everything else, and you don't leave breadcrumbs, I'm just like, meh. That's my hot take, where I'm like, meh. But, you know, everyone has their flavor of RP that they like. Alrighty. Now, we're going to look at the Achilles here. So I'm going to take off the bandaging. We're just going to make sure that grafting is good, site's not infected. Alright, no redness, swelling, pussiness. That's always a good sign. Let's go ahead, clean, and redress. Alrighty. Alright, how are we doing on a pain level? You still are on a slow drip of pain medication as well as antibiotic. On a scale of 1 to 10, where are we at? Okay, that's not bad at all. Alright, I'm going to go ahead. I'm going to spread this thermal blanket over you. Are you ready for visitors, or do you need a little bit of time to yourself? Okay. I'll go ahead. I'm going to reach out to them. We'll leave it open for a little while. If you need anything, feel free to 611. We'll be right back in here. Let you relax till those visitors come, okay? Alrighty. Yeah, this one. Yeah, the scenes have been a little much. Like I said, I'm more of a... if you're gonna do it, build tension, don't go for shock value. And try to script as least as you can. I agree. I'll be honest. Again, this is my unpopular opinion. I don't like serial killer arcs that go on longer than 4 weeks. I'm just like, I'm done with this. Okay, she must be back in observation.
Yo, dog, what good?
Hello, how you doing?
Hey, Mercy. I'm fine. Well, yeah, I guess I'm fine though. You know, yesterday had like a big thing going on.
Yeah. I'm gonna look you over because I'll be honest with you, they didn't give too much of a narrative into the medical report, so I'm just gonna look over the injuries and make sure that's going on before we call police, okay?
Okay.
Alright, let's just look you over. Gunshot wounds, there we go. Alright, not seeing any redness, swelling, pussiness, so that's good. I'm just going to go ahead and clean the areas, and I'm going to redress your bandages.
Alright. Not hurt.
No, very gently there. Okay.
Wow. Miracle worker.
That's what I do. That's what I do. That's what I'm going to do. I'm going to go ahead. I'm going to contact PD. I'm going to let them know that they're good to come pick you up and transport you, okay?
Okay, dog.
All right. If you need anything while we wait for them to arrive, just push that 611 button on the side of your bed and we'll get you taken care of, okay?
Okay, Doc. Should be all good though.
Alrighty.
Appreciate you.
Yeah, yeah. Okay, let's call 911.
Hello, Mercy. This is Iridescent.
Hi, Iridescent. I have Lauren Woods. She's in police custody. She is woken up from ICU and is ready to be released.
Lauren Woods. Lauren Woods. Okay, that was actually me and Elias. Woken up. So she hasn't been processed yet.
No.
Amazing. Okay, we'll head down to the hospital.
Alrighty, thank you. Bye-bye.
All right, thank you. Bye-bye.
Hi, Dawn.
Hi, Mercy. This is not 911 an emergency. How may I help you?
I already just spoke to Iridescent. What are you doing?
Okay, don't worry about it. Did you know Iridescent has a thing for Joe?
Oh, she has a huge thing for Joe.
I knew it.
Like,
Need to love tour them.
The biggest thing for Joe. I've been trying to wingman for her, but Joe's fucking hard.
You should rephrase that.
No, I think I'll stay with that phrasing.
Sure about that?
Yeah. He'll just be like, she's young. She's married. I'm like, oh, Jesus Christ. I'll be like, do you like spending time with her? He's like, it's been like twice. I'm like, okay, Joe.
Yeah.
Yeah, she like majorly likes him. And his birthday's
Just shut
Thursday,
up.
so I gave her some ideas.
Just set up a love tour. Just do it.
I think Joe would kill me.
Nah.
No, you think that I should just get Bryce to do a love tour?
Yes.
And Joe not be any the wiser?
Yes.
Okay, I'll tell him tomorrow.
Oh, fuck, I gotta go.
Bye.
Mhm.
Bye, Tom. So fucking stupid. That's not gonna be awkward at all for Joe. He'd kill me. Okay, while I wait, I can... Hello.
Hey, how's it going?
Good. Can I help you?
I woke up feeling like I was about to pass out.
Okay. Are you hungry?
No, I'm well refreshed.
Okay.
I just feel like if I were to get tackled, I might just be slumped over on the ground.
Okay, no worries. Here's a little bit more refreshment for you. How's
I
that feel?
appreciate it, Doc.
No
Much better. I
worries.
appreciate it.
Alrighty. Have a good day.
Yeah, you stay safe.
Okay. Going on a date he doesn't want, hosted by a guy he hates. Yeah. But also, Mercy kind of wants to get back at Joe because he keeps stirring with Bison. He had Mercy be his +1 and then told Mercy, I'm going to take a picture and send it to your boyfriend so he thinks I'm trying to steal you. And Mercy's like, what the fuck is wrong with you? So Mercy's also kind of okay with with him having to be miserable.
Hey, I'm always strapped, okay? Don't worry about me.
help you?
No. There's no Nancy wouldn't help me. No doctors were available. I've just been living with it.
She's been living with a gunshot wound.
Yeah.
Okay,
Nancy didn't help me.
Come back this way.
I woke up earlier on and I realized I was shot yesterday, you know.
What? This happened
Hey,
after you left?
Just last night.
Jesus.
Like late last night. Yeah, I really thought they didn't. They shot towards me. I didn't think they hit me, but they hit me. But yeah, I felt pain this morning when I woke up.
Oh my god.
I got fixed up, so I'm fine. I'm warm my voice. I'm fine.
Okay.
I love my voice sometimes. It's amazing.
Look, we started blasting for no reason.
Yeah, they do that sometimes.
Eh.
Yeah, no reason.
Right my rib.
Yeah, no reason.
Okay.
Sure.
All right.
Around my ribs, it went right through.
Okay. I'm going to flush and just make sure that there's no arterial or organ damage. Eh. Basically, we'll make sure that we're not going to have any like internal bleed, and there's not going to be any organs that like later on you're like, must bleed, and I'm like, motherfucker. So that's the medical terminology. Okay. Looks like it was a pretty clean through and through. I'm going to go ahead. I'm going to do a local anesthesia. So basically, I'm going to numb the area with lidocaine. So you won't feel anything, but you're going to feel like slight pressure as I just get it cleaned up and make sure that's good for, you know, the next gunshot.
Yeah.
What do you mean the next gunshot? What the fuck?
You think I'm gonna get shot again?
You live in Los Santos and you do crime. Yeah.
Nah, hold on.
Am I wrong?
No.
Chloe, Chloe,
No comment.
Chloe, I don't want to hear shit, Chloe. You're accident prone. You would probably shoot
I've been
yourself.
shot 3 times. I've been shot 3 times, actually.
Saying she's accident prone is really funny considering how I hurt my legs earlier as well.
He jumped out of a moving vehicle.
I fell out. The door wasn't latched, and I leaned on it. I wasn't going that
Fell,
fast.
Same thing, right?
No, jumping means there's intent. Falling means it was accidental.
I mean...
Right?
Sure.
Okay. I'll take it.
Yeah.
You know what? I'm gonna make sure nobody tows my vehicle.
You did park right in front, so
Yeah,
fine.
I'm gonna
Yeah,
make
go,
sure
go sit. I'll be all right.
No one impounds it.
All right, I'm just gonna give you a shot of doxycycline. That's an antibiotic. They'll work from the inside out to make sure you don't get infected. And then I'm gonna give you some pain medication.
So, when I fell out of the car, a cop responded because there's no EMS. She
Mhm.
kind of just like leaned up a little bit and then kind of got me to my feet and said, "You should go to the hospital."
Mm-hmm.
That's all she
Yeah.
did.
Yeah, so
She didn't help me. She didn't take me to the hospital. She didn't do anything. She just left me.
Yeah,
to
that's
get there on my own.
Yeah, that kind of sucks. Also, sounds
Grapeseed.
kind of typical, but yeah.
Thought she would drive me and help Nancy help me, but she doesn't like me. Nancy doesn't like me.
Oh, well, that sucks. But gotta love that community rapport. Am I right?
Yeah.
All right, darling. You
You seem
are
more concerned
all
about
good.
Chloe.
They see. Well, probably because it's Chloe.
Yeah, I'm learning. She's well known for not great reasons.
Yeah.
Ugh.
Yep, you're all patched up and good to go.
Yeah. Thank you.
You're welcome. Have fun doing illegal things.
No comment.
Yeah. Sadly, I'm needing food and drink. Why is that sadly? Let me go get food and drink for her. Do I have one in my pocket? I do. Just hand this to him. Alright, darling. Here we go. There you are. I still need to write that update to her report. Out your kisses, I've been needing stitches. It does not feel like Sunday. Luckily, I have a pretty easygoing week next week. I have one meeting next week. That's a doozy. What is with all these pot-bellied men?
Hey, buddy.
Like, what's going on here? It's like a theme. Okay. Lauren Woods is good to discharge. Bum, bum. Snotty. Patient awoke. Bandages, or I guess injuries. Examined. Cleaned. Sterilized. Fresh bandages. Applying. Elevated. Pulse and BP. Metoprolol. Administered. If I could feel. Administered. Changed for fashion and comfort. Then, and resting. EC's contacted for visitation. Ew.
You had a helmet on, shot in the head. The helmet blocked most of it, still had a graze to the forehead.
Okay.
Yeah.
Alejandro, what the fuck? I literally just left you. No limbs. No limbs are coming off.
Oh, all of your limbs are. Oh, shit.
No, none of his limbs.
Oh my god. Oh my god, you're gonna take all my limbs?
Oh, Alejandro!
Stop it!
No! Oh my
You
god.
gotta save his limbs. It's Alejandro.
He
Oh my
has
god,
a
save my limb.
he has a grace to the head. It's literally just me
No,
cleaning
don't take
and
my legs, please. I
Oh
don't
my
wanna
God,
be
Alejandro.
crippled like Mike
Alejandro, we'll
Benson.
get you a wheelchair.
Oh my god, thank you.
You're so goddamn loud. Please
going to
don't
kill
yell
you.
so much.
Oh, I'm sorry.
Oh my god, grapeseed officer. I'm so glad you're here. I think I'm gonna die. She's gonna take my feet.
You're not gonna die.
You're
Also,
gonna take
Kendrick,
my
why
feet. Don't take
why
my
the
feet.
hat and earrings? Why? What are you?
Because
Are
he
you?
looks dope in it. He's swag. How do
You
do,
look like
fellow kids?
Steve
You know that gif?
Buscemi when he's like,
Do you know that
"Hi,
gif when he
fellow
goes, How do you
kids."
do, fellow kids? Yeah, that's him. That is him. Oh, he's actually 28 years old.
Okay.
Swag.
Stop saying swag. Nope.
Swag.
Stop.
Gangsta.
Beautiful. I just
So
want you to
swaggy-licious.
know You're my favorite.
Oh my god. I cannot believe Mike Benjamin, the guy in the wheelchair that's crippled, shot me in the
Mike Benjamin.
Alejandro.
He didn't do it.
Alejandro,
was-
I swear to God.
Yes.
I swear to God.
What if it wasn't him, but
You're good. You're
Thank-
cleaned and you're bandaged. You're fine.
Oh,
You
thank
need to
you.
hang out with a new group of people, dude.
I'm thinking of getting his blood and becoming a lawyer.
Yeah, okay, I need you.
It was that. Okay, Dr. Mercy, I will be right back. I have to go pick up my son who just got released from prison.
Sorry, I forgot to
It's
change
okay.
channels.
My frames are being wonky right
Hi.
now.
I
Hi,
was riding my
hi.
bike. I was riding my bike and I caught a rock and I hit the barrier with my right leg. It's kind of bruised.
Okay. Let me just look at, I'm gonna check mobility real quick to just make sure we don't have any signs of a fracture. So if you will just like wiggle your ankle and sort of flex at your knee for me.
Yeah.
If we okay, I mean, people get robbed all the time.
Okay. Perfect. So what I'm going to do is I'm going to give you a really, really good cleaning. Make sure we take care of this road rash that's going on. And then we'll put an ice sleeve on. And that's going to help soothe as far as with that bruising. Okay. Unfortunately, bruising is topical. Not much we can do in the way of like pain management. But we're going to help ease what we can. All right, darling?
Yeah, I appreciate it.
No worries. What's your name?
Becca.
Becca?
Yeah.
Okay, Becca. I'm going to take off your mask just so you can get good oxygen flow while I'm doing this, okay?
Okay. Oh my gosh, everything's blurry.
It's okay. It's okay.
Can you put my glasses back on? Everything's so blurry.
I can't, but you'll be able to in just a moment, okay?
Okay, sorry.
You're
I'm
okay.
pretty much blind without them. Like right now, you're just like a big blurry blob.
I'm like that with people's glasses on.
Damn. Well, I'm sure you're not with my glasses. Yeah. Like if I look to my my left, I just
Mhm.
see like a brown and black blob and like a black blob with like blonde blob.
Okay.
She has -10 vision. Holy shit.
I can see you guys. I just can't. You're just blobs.
You're like legally blind.
Not legally blind. My glasses. Once my glasses are on, I see just fine.
All right, putting those eye sleeves
think
on
for-
ya.
think of her blobs.
But you just weird blurry. It just looks like a blurry blob of color.
All right, darling. There you go. You're all good, okay? You can put your glasses back on now.
Like I said, if you can't get it right, it could take.
Oh, hi. Oh, you're pretty.
Oh, well, thank you, darling. Alrighty, you all are good, Becca. I don't know if you're
Thank
released into
all.
PD custody or what, but you're
no,
good to go.
No, just
No,
just wait
I
and
hurt
see if she
myself.
needs a ride. Yeah.
Okay,
I might have a
perfect.
ride. I'm gonna give a friend a call.
She's not in custard.
Yay.
Oh, sorry
Oh, well.
about that.
I'll start calling custody. Custard just ice cream.
Arnie, are you conscious with me, darling? I just want to point out, if he would have used the radio, he would have had to come outside. And this wouldn't have happened.
Can we?
Yeah.
Come on. Yeah, I know. If it would have just stay there and take the fucking elevator down.
Yup.
Because you said you were outside. No.
Okay. I'm going to take off your hat. And I'm going to rinse. I'm just going to look at the severity, okay?
I can break this ghost. I need to be fed. I need food.
I got to call him Kendrick Lamar. He looks just like Kendrick Lamar. You didn't see him?
gotta call him that.
Arnie, how you
feeling, Matt?
Okay, it's just a grazing.
I think I stumbled and hit my head pretty hard on the pavement, that's all.
You know what? I hope you would die, you Norwegian asshole.
Oh my
Who the hell are
god!
you?
I hate you.
Oh, you're irrelevant, that's who you are.
Arnie,
I
Jesus
hate you.
Christ!
To the bed, okay?
Go with your smoked fish, gang. Go with your smoked fish, man. I hate your ass.
You don't
I'm
even know
glad you
about my
got shot.
culture. How can you say stuff like that? You don't even know what we eat in Norway. Shut up.
Yeah, smoked fish or
Shut
some shit
up.
like that, gang.
Don't you have that one dish that's like fish and tomato sauce?
Just
I'm so
help
mad
me. I don't care
Nah,
about
this
fish
asshole
tomatoes.
Norwegian
Oh
called
my
me when
God,
I
Nancy,
crashed
bring
on
me
the train
out of here,
tracks once, man. I hate him.
Nancy,
I
bring
hate
me
him.
out of here, Nancy.
Benji, be quiet! Alejandro, shut up!
God. No, not obstruction.
Jesus.
No.
Yap, 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 yap.
Somebody shoot that guy in the head again.
Just,
He's broken the
Arnie,
law.
if you don't
You
mind,
missed.
just make sure people radio me whenever they're
Yeah,
bringing
I mean,
someone.
that's his fault, though, you know.
Yeah. Thank you.
I get really
Did something else happen to you?
No, they just dragged me here and cuffed me to the bed. I am that shit. I'm innocent, yo. I need food. That's what I need.
You need food?
I need food and drink. They ain't
Are you
feeding
able to-
me. No, no.
Can you grab that?
I'm
No?
cuffed. No, I'm cuffed. I
I'm gonna
can't.
hand it to the cop. Kendrick, give him this food so he doesn't starve. Just cuff him to the bed. Here.
Kendrick Lamar.
Alright. There's food.
There. Alejandro, you dumbass. What the hell?
Oh my God, I did it for the gang. I
Listen.
did it for the gang, Mercy.
Well, you be smarter for the gang, you shit.
You're right, but I did it for the gang. You see that guy's mustache? It's so fake. I had to shoot him.
Okay, okay.
Here's your food, okay? You get it.
Oh, okay. Oh, thank you.
Come on.
Okay, I'm gonna put you here, and I'm gonna get you taken care of.
Oh, I'm so sorry. I didn't mean to do that. I was trying to eat. I was trying to eat.
You're
I was
pretty
trying to eat.
cognizant. Doesn't seem like any vital has been hit. I'm just gonna get this all nice and clean. Okay. Okay.
I need morphine. I need fentanyl. I need all the fentanyl you
You're not getting any of that shit because you were a dumbass in the front of the hospital while I was staying there and could have hit me, you little bitch.
I need fent, please.
No.
I need a fent, gang.
No.
Special.
Yeah.
Put that shit on the weed.
You could have shot me, you little shit.
You gotta put that shit under the
But I
weed.
didn't.
I really don't like that Norwegian.
You're getting
crap.
local lidocaine.
I didn't mean to try. Eat that Norwegian. Urgh. Shit. Hey, man.
You know I almost pulled my gun on you?
Oh my God, no.
Ain't no way.
Yeah.
I would never shoot an EMS.
I'm a doctor. And you know
I
this.
would never shoot EMS or a doctor. I would just shoot
Mhm.
cop.
Mm-hmm.
You know, Alejandro?
Only for the gang.
Alejandro, I'm doing the doomsday plan.
Oh my God, she's
Sweet.
expecting me with fent. Let's go.
No.
Fuck, what is it then?
That was doxycycline, an antibiotic.
Fuck, I just want fent.
You're not getting fent.
I just want fentanyl. Kendrick,
No.
please, some fent, Kendrick. Oh, fuck.
I know you're medically
Okay.
treated, okay, but we gotta keep you right here.
Top Sheriff, right?
Oh my god, I can't wait for you to pay for my fine.
What you mean pay for your fine, gang?
Whoa, what do you
single.
mean? I did it for the gang.
Listen, gang, I already paid you 12K, man. All right.
Whoa,
you got that money,
whoa,
gang.
whoa. I gotta pay like an extra 20K, man. I'm cooked. They're gonna toss me on these warrants, gang. I'm gonna be out there. I'll be out there cooking fucking slop for
let me
every
do the
prisoner
math
for
real
the
quick,
next
like-
20 years, gang.
All right.
You
You
got
are
me though, right?
treated.
You got me though. Thank you. Thank you.
So
Can I get just
disappointed.
one quick fence?
No.
I'm sorry.
No, I'm disappointed
that
in
I
you.
lost that. I'm disappointed that I got shot. That's what I'm disappointed about.
The next therapy session, I'm siding with Benji on whatever it is.
No,
Yep,
Benji-
that's your
Benji
pun.
told me to
Nope,
do it.
I'm
Benji said
nope.
shoot that motherfucker.
Hello.
Hello.
What do you want?
He's good. He's good to go. Who attempted to murder you?
That was me.
And I'm stuck. I don't want to be on this bed anymore.
Alrighty, what do we got going on here?
It's just
Oh
a
my
leg.
god.
And I got my wind kicked out of me.
Got the wind kicked out of you?
Yeah, she landed on me with a motorbike.
that's a lot of wind.
It's always the left leg.
Mike Benjamin. Still cuffed, man. I'm cuffed.
Okay, I'm gonna give you some nice little ice sleeves over the bruises. Unfortunately, because this bruises has topicals, so you're gonna be in a little bit of pain for the day.
Oh, that's fine.
This song is so dramatic. What?
I hope I at least get some sleep.
Maybe, maybe not. Long here, I hope you understand. For a high school relationship, very dramatic. I mean, 2 days is pretty good. Okay, you are good to go. Take it easy. Don't
Thank
fall
you
off
very
the
much.
bike.
I mean, technically I was landed on, so I kind of... Well, actually, no, never mind. I fall off the bike.
Okay, well, don't have anybody get on top of you.
Wise words.
Mm-hmm.
I like this wall. I like this wall. It looks
I
good.
swear to God.
I can't. I love this wall. I'm not moving until I'm not moving. I'm not.
Okay.
Look at this wall.
I'm gonna carry you
Fuck.
out then. I don't care.
This is abuse. Oh fuck my.
Oh,
Yeah, let's
I'm
go
not
get the
gonna
Let
bike
me
back.
go.
Yeah.
Unhand
No.
me right now. Unhand
No.
me
No
immediately.
No wheelchair for me this time.
Bye, Alejandro.
Goodbye. Have a good day, Mercy. They're gonna serve a warrant on me.
Okay.
What you say to me? What you say to me?
You hate Norwegians. Shame on you.
I hate the Norwegians, man. I hate the Swedish too. I love Finnish people though. They're cool.
Jesus Christ.
I like Finnish people.
Oh, nah, not Finnish people.
Alrighty.
She's been unconscious the whole time.
Okay, let me just here.
Yep, here.
We're gonna go in the far over here. Okay. Doors don't work whenever two people are going in at the same time. Imogen, get out! God almighty. Alrighty, Tegan. Let's go ahead and first let's start with getting a positive identification on the person and make sure that there's no allergies that we need to be concerned with. It looks like Ember, but I don't want to assume. Alrighty. It is who I thought it was. So we are going to go ahead and we're going to start with propofol. I want you to up that dosage about 15% of what we would normally do. We're also going to utilize slow drip morphine. We're going to do doxycycline on a drip. Let's get an O2 mask, put Vaseline in the nose to where we don't get any bleeding. And then let's also do a line of glucose. I want to take as much pressure and get some nutrients in the body to help the restorative process. All right, we're going to go ahead. We're going to examine for severity of injury. Bruised torso, so there's no telling what's going on. Alrighty, let's go ahead. We've got a possible punctured lung going on here just from previous breakage, and now it's being shattered again. I'm gonna move over the cart for the portable x-ray to where we can make sure that we get a fine image. We don't want to do an entry point and cause any more impact than what's necessary. Let's go ahead and move that portable machine over here. All right, we're going to get a nice image over the chest area and just see exactly how many ribs are broken, how many are shattered, and then going from there. Alrighty, looks like we got 2 broken, 1 that's definitely shattered. It's going to need a fixation here. And that, of course, is on which side, Tegan? Let's see if you remember what's our left and what's our right. Good job, Tegan. I knew you'd remember. Alrighty. Let's go ahead and first we're going to make an incision to the side of the torso. We're going to see just exactly how severe this is and see if we're going to have to intubate. Alrighty, I misspelled incision there. Alright, let's go ahead. We've got access now. Gonna go with a little bit of laparoscopic and see just exactly what is going from our area. Give me suction, Tegan. You see just exactly how damaged the lung is. Doctors are always the most dramatic. I'm including Mercy in that. I don't know what your previous injury was. All right, Tegan. I need you to take over Keep Suction so that I can get familiar with her previous case.
EMS from PD. Can we get a 52 to LSSD? We have a suspect complaining about getting hit.
And it'd be one that there's no medical report on. So, all right, we have a laceration in the lung. We're going to go ahead. We're going to repair the laceration. We're also going to do a tube in here to get any excess fluids out. Let's start with the laceration first, though. Let's go ahead and let's do a flush and a cleaning out of all the shards. We don't need any more shredding while we're repairing a lung. We're going to partner this with the Da Vinci machine and make sure we get all those fine little particles. Now, with this 2-inch laceration, we're going to go in, we're going to set with microsutures and a mesh patch over. We're utilizing both just because of it being a reopening, so I don't want to rely on one for structural integrity. Once we get the microsutures and the mesh patch on top of that, then we are going to start, we're going to put the tube in to get the excess fluids removed.
Uh-oh.
Uh-oh.
Alrighty. Let's go ahead and put the tube in.
It's 36-23 on the 47.
Echo 15, 23,
As that starts to
52,
drain off, let's go with the
LSSD,
fixation of the rib.
code 6.
Now to make sure that we get a secure alignment here, we're going to resection a little bit. I am going to sand a little bit of the edging to make sure we get a firm alignment before putting our Gemini rod. Alrighty, let's do one additional flush and clean. Now, Tegan, because of the blood loss as we transfer over, I want to do an ONED blood bath. We'll let that just go ahead and empty out. Might do 2, but let's stick with 1 for right now. Alrighty, with everything that we just did, I'm going to start closing up. But Tegan, in your opinion, would we be doing observation or ICU tonight? Okay, now what we are going to do is we're going to move any damaged necrotic tissue before we close up. This just helps with scar tissue not building up to where we have future incidents to where we can't get to an organ or scar tissue is blocking something. This one step will just keep that from happening. Starting to close now. All right, let's go ahead. Let's move everything to a portable stand. We're going to take her into observation and we'll contact emergency contacts from there. You feel
Flight risk
it
36-24. I guess I'm gonna go move up towards where they're chasing this person. I guess. I don't know. Maybe they're gonna get shot.
Which 47 are you at?
The one near the Vinewoods.
We'll start taking a break. They're going to hate me, but I don't
If,
care.
Do you need me to go up to the LSSD one, or?
I can't find one up here. So I don't know if there was miscommunication over the
I
radio.
think they needed it in the cells. You have keys to the LSSD. You should be able to go find your way to the cells. It's a bit tough, but you'll be able to find it.
Alrighty. Come on. Come on. There we go. Designated as an emergency contact for Ember Grace. She is currently recovering In observation. And Eclipse Medical. Following surgery. Visitation is open, though she will likely complete recovery at home. There we go. Okay. Alrighty, Tegan. We'll go ahead. We'll let her rest until the profile wears off. Feel free to come in and check on her. I am about to go 42, but emergency contacts have been notified. Alrighty, darling. Good surgery, Tegan. Good surgery. Dr. Mercy going 1042.
Have a good one.
Where's our other doctor that's supposed to be on today? Ah, gotcha. Okay, no worries. Hi, Sunny.
Hey there.
Hello. Just gonna put you up here in the bed where I can get a little bit better access to you.
Appreciate it.
Alright.
The floor is helpful for bruising.
I mean, it's cold, so it helps soothe a little bit, yeah.
You know what also helps with bruising?
Not getting bruised?
No, not being stomped on in the fucking head.
Tomato, tomato. We kind of said the same thing. Just gonna clean this all up. Oh, look at that. I like the thing you have shaved into your fade. It's cute. Looks like the sole of a shoe. It's creative. Never seen that before.
I don't think that's cut. That's...
No, I don't know what you're talking.
You need to tell your barber that is creative as hell.
I can see the blood on your shoe.
Listen, I live on the
It
south
could be
side.
barbecue sauce. She runs the barbecue
So,
restaurant.
That is very correct.
I know I'm her employee. She wasn't in... This happened out on the street.
Okay, lick her shoe and see if it's blood or barbecue.
I'm not her husband.
You're tasting. You're not like... "Arrrr." There you go.
Hello.
Sunny, what are you doing?
My brother is currently in surgery.
Okay, okay.
Yes.
Critical?
What
Is he
are you
okay?
doing?
Are you okay?
I think he has the sickness.
What do you mean the sickness?
The sickness.
What do you mean?
Well, he was running a temperature. Before long, he'll be biting people's faces off.
Okay, 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 okay. And it feels like oh. I love this version of the song. Can angels sighing? I have no choice. I hear your voice.
It does.
Mm-hmm.
It's in the sauce.
Alrighty, let's get you cleaned up with some ice packs on you.
Hey, got you another patient.
Put him in another bed.
I assaulted and batteried him.
Okay.
I told you I could stand up. You didn't need to put me in a fucking bed.
Alrighty, here we go.
You have a weak punch.
Just wiping your face off. Getting some ice sleeves on you.
He hits like a toddler.
Okay.
Are you gonna take that, Stacy?
It's a great song too.
He's making a phone call. He's gonna call somebody who cares.
Leon, no, baby. There you go.
All right, Brock Booker. I whooped Richard Stoka's ass and Bishop Hayes' ass. Stay at the hospital. They got warrants.
Alrighty.
Oh my god!
Leon, baby, you need to
I don't have a
stop.
warrant.
Wow.
My dog is going crazy. Leon, you wanted in here, baby. You literally ran in here.
Yeah.
Dogs are so fickle.
Warrant, but
Can you double check for me, please?
I was in rehab for a week.
Alrighty, there you go.
Lovely. Thank you.
Yep, you're welcome.
Richard Stroka.
This song is on my not. Why? Why not while driving? Hello.
Hey, I'm getting face. Hey, this person's this guy got hurt. Apparently, he fell off a building.
Oh Jesus. Okay.
Yeah, he's gonna pay me.
No, she's a human tow truck lady.
No, but she is. She does look like a human lady.
Yeah, I'm
You
getting
might get a lucrative going. You could be like getting like all these
the
warrants.
people
You could be like a
inbound.
warrant buster.
Mm-hmm.
I'm gonna be sticking with him because he better pay me.
Oh, okay. Just gonna look over and see just how severe the injuries are.
Hey, who'd that be?
I don't know.
They got a
Hello,
warrant for
Stacy.
arrest.
I don't know. He
You got a
better
warrant
pay
for
me
arrest,
though.
dog?
No.
Brock Booker paying $500 a head for warrants.
Oh, what are you, bounty hunters?
That's crazy.
No, I'm just whooping people's asses lately. These hands are rated E for everyone.
Nice.
Alrighty.
Mercy, whose ass you need me to whoop? You need some work.
I can whip my own asses, thank you. Alright, you got lots of bruises. I'm just gonna clean you up and get you some eye sleeves put on them, okay, darling?
And those Russes look terrible.
All right, to the house.
My hat.
Thank you, guys. Alrighty. There we go, darling.
Oh, thank you very much.
You're welcome. You're welcome.
Are you gonna pay me?
Sure. What's your state ID?
Certain songs put me in a fat. This song makes you want to speed? You know what? I get it. I get it. All my ketamine lovers, throw your hands in the air. Oh, you didn't do it. You're not getting ketamine. No, no. What's your name?
Ketamine.
You forgot your name.
No.
What's your name?
Smitty.
Yeah, Smitty, you're not getting ketamine.
Why not?
Because.
Not even if I take it here.
Nope.
Why?
But nice try.
Damn.
You tried.
Not
You
even
tried.
like
You
a
tried.
little bit.
Nope, you tried. You should put your hands up quicker.
They were up.
Hi. That's how Mercy handles it. True, B. Arthur, she was.
I don't want to smoke crack.
What? You don't want to smoke crack? Oh, you eat crack. You eat it. I.
That's crack. No, just regular crack.
What about space crack?
That's why it sounds familiar.
Space crack. You got.
I want to point out, I'm out in your
yeah.
fucking ass. I'm out in your ass.
Who?
Sean says he didn't know majority of the names you brought up either.
Yeah, but I stayed quiet and I didn't. I wasn't outwardly basically acting a fool.
Because I don't know, that means I'm a fool? What?
No, well, you should probably know most of them.
I wasn't taught a lot of those people in school. The 5 that I mentioned, I was taught most about.
You
School
know, it's
system,
fine.
Really.
It's fine. It's fine.
What the hell?
I learned about Beyonce while you were gone.
Oh, that's who you taught him, Sean, was Beyonce.
He said Aunt Jemima.
I said, who is your most who's the most famous lady you know? And hey,
He said
excuse me,
Aunt
hang on.
Jemima, and I'm pretty
Hang on,
sure
hang on.
Aunt Jemima is not Aunt Jemima anymore.
Hang on. I got something for
I
that.
actually need to
First
look
of all,
this up. Hold on.
No, she's being put back on the bottle. She is being put back on the bottle.
Oh, okay.
That was a big news thing last year.
Oh my god.
Apparently, Aunt Jemima is not real. I am now learning that.
Okay. Okay.
It's just
okay.
a mascot.
Okay. Okay. Okay.
It's I'm a little disappointed.
Babe.
I asked who is the most important person in history that Sean knew, and he said Beyonce. And I said somebody that actually changed something historically, and he said Beyonce because she changed the music culture.
I mean, she did change the industry completely. But me personally, I don't even really like her that much. I mean, I'm just
Me
I'm
either.
Just kidding.
No, I
love-
don't.
No, I
Beyonce,
love Beyonce,
you can hear me
Praise
out. I
Beyonce.
don't. I
wanna
don't,
die.
Queen Bee. I don't.
Single lady as well. I'm in the car.
Queen Bee, more like not.
As well. And then you hear spooky sounds like right now. Do you hear this?
Take that, Beyonce.
Oh, why did it get dark?
Oh, just Did you just call her Beyonce?
Yeah.
Oh yeah.
I
name
know Sean is shaking
5
his head
men,
right now.
Sean.
Don't think that's how you spell
What?
exercises. I think it's EXEC.
I don't care
I'm gonna
about
have to do
men.
Google. This is embarrassing.
You're a man.
I mean, and you're gay. You kind of do care about.
Yeah, what the hell? That's all you care about.
It is. Why do I keep spelling it like that?
What does that mean?
X.
Well, name 5 men.
No, just so they charge me.
All right, sorry. You don't
I
even
just
name
don't care
Astro?
enough. Wow.
I got plenty.
Radio check channel 19.
Not even like
EMS from
George
PD.
Washington, who's actually a shithead.
EMS.
Believe it
You
or
have a
not.
unit responding to
First like 20
D47
presidents were
on
all
Chiliad.
shitheads.
Well, duh.
Yeah.
Racists. I didn't know more
Look at that.
most of them were, to be
We're
honest,
living
until
now. Looks
recently.
like a fall victim.
Lincoln.
Except him, he's cool. Actually,
Yeah,
him
they're
and his
correcting
and the one that went right
car
after him,
victim.
because the guy right after him like pretty
Oh,
much
okay.
like said Lincoln did all the right things, right? Like he was praising
Yeah.
Lincoln. for all
I'm
the
gonna be
stuff he
addicted an APB.
did. Everybody but those two.
Yeah.
Shit, the first